The human liver is a high-capacity chemical plant responsible for detoxifying blood and storing energy. It is also one of the only organs that can regenerate tissue on demand, yet it fails in total silence. Damage builds over years, hidden behind common, easily ignored signals: a slight accumulation of fat, a minor elevation in liver enzymes on a routine blood test, or even just a lingering sense of fatigue. This quiet progression often ends abruptly with a diagnosis of liver cirrhosis. Historically, patients and doctors alike have viewed this stage as an irreversible decline. By the time the diagnosis arrives, the organ has often been eroding for years without ever triggering a single biological alarm. Information on the disease is often split between two extremes: clinical despair that suggests no recovery is possible, and a flood of miracle liver detoxes and unverified cures found online. Curious, medical science is forced to navigate between these points to determine if end-stage fatty liver can actually improve, or if the idea of reversal is a dangerous myth. While the liver is capable of extraordinary repair, survival depends on hitting a specific, aggressive window of intervention. Avoiding organ failure requires moving past both total pessimism and snake oil promises to focus on the precise biological threshold of reversibility. Cirrhosis begins when microscopic fat droplets silently invade healthy liver cells. These expanding cells trigger steatohepatitis, launching a chronic inflammatory response. To repair this injury, the body lays down fibrosis, dense scar tissue. Finally, these webs transform the flexible organ into a solid, impenetrable mass. Cirrhosis marks the final, hardened consequence of a decade-long microscopic battle. Clinical data shows that reversal is conditional. Early fibrosis and even compensated cirrhosis, where the organ still functions despite scarring, often show measurable improvement. By aggressively treating the underlying cause, the liver can be prompted to halt inflammation and begin dissolving existing scar tissue to make room for healthy cells. This graph demarcates the point of no return. While the green window represents the opportunity for repair, the red zone signifies where scar tissue becomes so dense that biological reversal is physically impossible. Recovery relies on pulling the emergency brake before the organ crosses that threshold of permanence. The most effective way to trigger this repair is through a strategic reduction of 7 to 10% of total body weight. However, crash diets often flood the bloodstream with free fatty acids, which increases metabolic stress on an already failing liver. True intervention requires removing primary attackers, specifically cutting out alcohol, all sugary drinks, and hidden excess fructose. A Mediterranean-style diet and daily 30-minute walks function as systemic tools to lower inflammation and address the insulin resistance driving the fat storage. Recovery also depends on sleep and stress management. Chronic sleep deprivation keeps the body flooded with cortisol, a hormone that signals the body to store fat and accelerates cellular injury. Healing a damaged liver requires rewiring the entire metabolic environment of the body. There is a reality check that lifestyle protocols cannot ignore. If cirrhosis has crossed into the severe threshold, lifestyle changes alone are insufficient. At this stage, survival requires clinical management, including hepatologist monitoring, regular cancer screenings, and specialized fluid management. In cases of total uncompensated failure, all efforts must pivot toward a liver transplant evaluation. Lifestyle protocols provide the necessary environment for healing, but they cannot bypass a structural collapse that requires surgical intervention. A cirrhosis diagnosis serves as a final, urgent warning from the body. Daily movement, consistent sleep, and nutritional changes act as direct biological instructions for the organ to rebuild itself. The liver is hardwired to regenerate, provided the intervention begins before the biological clock runs out.